For nearly 3 years, the most common words we heard were coronavirus, COVID-19, etc., mask, and so on. Because this pandemic is all around us and has claimed the lives of many people around us. But at the same time, have you forgotten about another disease that also takes lives? That is dengue. So, today we're going to talk about both of these diseases.
What is COVID-19? 2019 novel coronavirus is officially named SARS-CoV-2, which is a virus that causes COVID-19 disease. This respiratory disease was first identified in Wuhan, Hubei province, China. Globally, the spread of COVID-19 has severely impacted people's lives, whether or not they have been infected with this virus. In January 2020, the U.S. Centers for Disease Control and Prevention, CDC, declared the new coronavirus outbreak a global public health emergency. Coronaviruses are part of a large family of viruses that are commonly found in many different species of animals. These different chains of viruses can eventually infect humans and cause a range of different diseases, including COVID-19. Severe acute respiratory syndrome, SARS, Middle East respiratory syndrome, MERS, and even the common cold. The disease is transmitted mainly from person to person, usually when coming into contact with a patient who is sneezing or coughing, or when speaking in close proximity. The virus can be spread by small droplets from the lungs and airways of an infected person, and these droplets can be easily spread through the air to those around them. Sometimes, the virus in droplets can also be spread to people further away if the air is moving quickly indoors. People who live together can easily spread the virus, but it can be spread by talking in close proximity, shaking hands, hugging, eating together, or even singing together in a gathering. When eating at a restaurant, the risk of infection increases because people are close to each other and do not cover their faces. It is also possible to get sick from touching an object that has the virus trapped in it and then touching your lips, nose, or eyes. However, this is likely to be less common. Being infected makes it possible to spread the virus to others, even if there are no symptoms at all.
Then, what is dengue fever? Dengue fever is an extremely common and contagious disease in our country that spreads among people through the bite of vector mosquitoes, Aedes aegypti and Aedes albopictus, that carry the virus. It is a disease that causes fever and other flu-like symptoms. It is caused by a virus that is transmitted to humans by the bite of a mosquito. Bone pain overflow or severe bone pain fever is one of the more serious forms of the disease. If not diagnosed and treated immediately, it can lead to dangerous complications. Dengue fever viruses belong to the flavivirus family and can be classified into 4 serotypes. The incubation period of dengue fever ranges from 4 to 7 days, and the onset of the disease is divided into 3 phases, namely the fever phase, the critical phase, and the recovery phase.
When a person is unfortunately infected with COVID-19, they may experience this condition. Symptoms may include fever, cough, breathlessness, weakness, chills, myalgia, headache, sore throat, runny nose, problems with smell or taste. Some people may even have no symptom at all.
Symptoms of infection with dengue fever, on the other hand, are chills muscle, joint, or bone pain, severe headache, pain behind the eyes, skin rash, regurgitation and vomiting, swelling of the glands, easy bruising and mild bleeding from the nose or gums.
So, how do we prevent COVID-19 and dengue? Firstly, to prevent COVID-19, we need to wear a mask. This must be worn when going out in public, making sure the mask covers the mouth and nose. Second, keep a social distance. This means avoiding contact with the sick and keeping at least 6 feet, about 2 meters away from others outdoors, as the virus is easily spread through close contact and it is not always known who the infected person is. Wash your hands. Wash your hands regularly with soap and water, as this will also help prevent other illnesses such as influenza and the common cold. Try to avoid touching your face with your hands when you are not washing them. If there is no water source around, use a no-rinse sanitizing gel.
Gels with over or equal to 75% alcohol content are most effective. Exercise regularly, eat a healthy diet, and get vaccines.
Prevention of dengue fever requires to ensure that the breeding grounds of Aedes mosquitoes, such as indoor containers that can hold water such as vases, cisterns, refrigerated food mats, outdoor discarded tires, plastic bags, empty cans, gutters, etc. are always clean enough to avoid Aedes aegypti breeding. Wear loose-fitting clothing that covers your arms and legs. Wear socks and shoes to cover your legs and feet. Limit your outdoor activities. Do not open window unless you have a window screen. Sleep under a mosquito net.
Prevention is better than cure. Protecting your health starts with you and me. Let's together prevent COVID-19 and dengue.